How do endoscopy and biopsy diagnose lymphoma of the stomach? Imagine trying to find a tiny hidden problem inside the stomach. That's where endoscopy and biopsy come into play. These are the main tools doctors use to diagnose lymphoma of the stomach, especially a type called gastric mucosa-associated lymphoid tissue lymphoma, or MALT lymphoma. During an endoscopy, a doctor inserts a thin, flexible tube with a small camera at the end through the mouth and into the stomach. This allows the doctor to see the inside lining of the stomach clearly. They look for any unusual signs like ulcers, irregular patches, or lumps that might suggest lymphoma or other issues. The camera helps guide the doctor to suspicious areas that need closer examination. Once these areas are identified, the doctor uses tiny forceps passed through the endoscope to gently pinch off small pieces of tissue from the stomach lining. These tissue samples are called biopsies. The samples are then sent to a lab where pathologists examine them under a microscope. They look for specific features of lymphoma cells, such as dense collections of lymphocytes, lymphoepithelial lesions, or abnormal cell shapes. These clues help confirm whether lymphoma is present and what type it might be. Diagnosing stomach lymphoma with biopsy can sometimes be tricky. Lymphoma cells often grow deeper in the stomach wall, in layers called the deep mucosa or submucosa. Superficial biopsies might miss these deeper cells, leading to false negatives. To improve accuracy, doctors usually take multiple biopsies from different parts of the stomach, including areas that look normal. On average, about 10 tissue samples may be collected during one endoscopy to increase the chance of catching lymphoma cells. In some cases, standard biopsies may not provide enough tissue or may not find the lymphoma. When that happens, more advanced techniques like jumbo biopsies, endoscopic mucosal resection, or endoscopic submucosal dissection are used. These methods allow for larger and deeper tissue samples, making it easier to identify lymphoma cells. Once the tissue confirms lymphoma, additional tests are done on the samples to determine the exact subtype and how aggressive it might be. This information is essential for planning the best treatment approach. In summary, endoscopy allows doctors to see inside the stomach and identify suspicious areas, while biopsy provides the tissue needed to make a definitive diagnosis. Together, these procedures are the cornerstone of diagnosing stomach lymphoma. Because of the tumor's growth patterns, multiple and sometimes deeper biopsies are often necessary. Always remember, diagnosis and treatment should be guided by healthcare professionals who specialize in these conditions, ensuring the most accurate and personalized care.